hospital infrastructure renewal? And more specifically, do you have a strategy for protecting universal access to health care?
Thank you. There is no role for the private sector. All infrastructure renewal paid for and owned by the public purse.
Our record is clear to maintain healthcare in a public record, in a public funded and controlled runs. That's what we did the last 4 years. And also we're going to continue our initiatives because I think the right things to do.
This is the public statement of the PC party. This is what I believe in. This is what I stand behind. And he says, a John Tory government will improve access to services, decrease wait times, and improve the funding flow. We will work with both public and private sector partners to deliver the best quality of care as long as it is universally accessible and paid for by OHIP.
I was talking to an acquaintance of mine, and he told me about the rumor. He said that the Green Party wanted to privatize healthcare. So one of the things I thought I was going to do is I was going to set the record straight. So I'm going to read to you right from the platform. The Green Party believes that the healthcare system should be publicly funded, publicly delivered, and publicly accountable. The Canadian single-payer system is affordable, effective, and provides care for everyone. Healthcare reform is urgently needed if we're going to have a healthcare system that is sustainable and viable in the future. The Green Party has a plan that will offer more choice, emphasize prevention, and be accountable to the public. I want to say that. Publicly funded, publicly accountable, and publicly delivered. See, I've got nothing wrong with business. I really don't think that there's anything wrong with businesses. I mean, they have a very clear goal. Their job is to make money. So the private sector is there to turn profit. The way to turn profit is to reduce your costs and increase your profit. Increase your revenue. Obviously, we already have publicly funded but private healthcare delivered. When I go to get blood tests, that's by a private lab, but OHIP pays for it. When I go to get my glasses, that's privately delivered. So are my pharmaceutical, or my drugs, privately delivered. But once again, of course, in many cases, it's publicly funded. We want to make sure that this is sort of the system that stays in place. What we want to do is make sure that, especially in long-term care centers, we want to create incentives for the establishment of community-based, non-profit long-term care facilities to displace profit as the prime motivator as LTC facilities. If your job is to make money, if your role, your primary goal is to make money, your primary priority is not the patient. Thank you, sir.
Ladies and gentlemen, so the questions are, what's our role and what's our position on privatization? That first part of the question we answer as follows. Keep OHIP. Keep it a Crown-operated, Crown-owned health insurer, which is what it is. But no longer fund it with taxes. Instead, let people keep their money and choose whether they want to buy OHIP, which should be price controlled as it is now, open to all people regardless of health as it is now, in full compliance with the Canada Health Act, making sure everybody can get access to OHIP on the same terms. But for those people who aren't feeling satisfied by what OHIP is delivering, they should be able to take their money and use it other ways. They should have the option of buying from a private insurer instead of OHIP. They should have the option of not buying insurance at all if that's what they want to do with their money. It is their money. It is their body. They are paying for their own health, as they should. So the Freedom Party's answer to the question of privatization is allow private sector insurers to compete with OHIP and give people back their money so they can choose whether to stay in OHIP or to go into other private options. How will we protect the public system, the OHIP system, by making sure that while we allow choice, we comply with the Canada Health Act, the primary provision of which is provide access to everyone, guarantee access to everyone on the same terms. The Canada Health Act does not say it has to be tax funded. It doesn't say anything about how those terms have to be set, but they have to be the same for everybody, and that's what we would do. And we would make sure, as I said, that every patient, regardless of their health, would have access to OHIP if that's what they wanted to buy.